The medical experts were speaking to the student body and stakeholders on the effects of COVID-19 and AstraZeneca vaccine. The aim is to clarify misinformation circulating on social media and the AstraZeneca vaccination rollout, and they were supportive of the vaccination rollout program in the country.
We need a vaccine to prevent people from getting sick themselves and to prevent people from spreading it around the community.
Following the government's plan to roll out the AstraZeneca vaccine in the country, citizens took to social media questioning the vaccine. They were concerned if the vaccines are safe to use in the country, following reports of side effects being reported in other countries. Professor John Vince explained, saying the vaccines are safe and they are being used around the world.
They want to make sure that they get these reports. They want to make sure that it's not related to the vaccine. But what the newspapers don't show is that 3 days later, these countries have started using the vaccine again because they've had a look at all the data, very careful. They've got all the fancy
evidence in Europe and the UK and now in Australia and now also in Papua New Guinea who've had the vaccine, and they're responding in exactly the same way as we would expect.
The experts further explained that among other vaccines developed, 3 vaccines were approved. However, the AstraZeneca vaccine was approved to be rolled out in PNG as it is DNA-based and stable. They further explained the vaccines that are to be rolled out through the COVAX facility, saying they have been involved in rolling out other vaccines in the country for many years.
There are only 3 that have been fully approved by the World Health Organization. There may well be half a dozen more within the next 6 months. But these are the only 3, and of those 3, the AZ vaccine is by far the most suitable and practical for use in Papua New Guinea.
The efficacy might be as high as 90%. The Pfizer vaccine and Moderna vaccines might have efficacy as high as 90% compared to 79% efficacy for our AstraZeneca vaccine. But because you cannot maintain the cold chain, a 90% efficacy in US coming to Papua New Guinea and going to a village remote in Papua New Guinea, and by the time it goes into someone's arm, it could be zero efficacy because we did not maintain the minus 70 degrees Celsius cold chain that is a requirement of this vaccine.
Chief Physician Dr. Sam Yokupua encouraged people to be safe and not to be sick in this period. He says though people are vaccinated, they can contract other diseases.
You need to go and stay close to the TB patient and sleep with them, and then we have to take the necessary precautions, even though we've got the vaccines. So yes, we've been immunized, but if we don't protect ourselves, we can expose ourselves and get a TB. Exactly the same mechanism. Even though we get vaccinated, we must still do the necessary to prevent, getting the infection or giving to others. So,
Rayon Lakingu National, EMTV News.